Hi guys, welcome back to the channel. If you're new, thanks for subscribing. And definitely if you're an oldie but a goodie, thanks for coming back. In today's video, I'm going to be discussing home birth versus hospital birth. I have had both of those, so I definitely wanted to just acknowledge one of our subscribers, Bianca9779, had reached out on our home birth video. If you haven't already watched it, please check it out, about just my recommendation, really not my recommendation, but just my take on home birth versus hospital birth. So we'll be diving in on that today. Stay tuned. Okay, guys, so today is a very good vlog. You know, it's quiet. I'm in my corner with our new baby Noah. Um, and yes, Noah's growing. He'll be 9 weeks old tomorrow. Is it Saturday today? Yes, it's Saturday. So he'll be 9 weeks old tomorrow. And I just wanted to again shout out our subscriber, Bianca9779, just for your just mentioning and having a question about the home birthing experience versus my hospital or a hospital experience. So I just wanted to do a video on that because I feel like a lot of people have that question. A lot of moms on different across my different platforms have actually talked to me about my journey from birthing our first son, Gideon, in the hospital in Arizona. Now, I did have a midwife through the doctor's office I was going to. However, immediately, I don't know, I just went with my gut, and I knew I didn't want a traditional like provider, and I love that I could be more flexible with like my desires, the things that I felt like I would need during my birthing experience and throughout the pregnancy. So the appointments regarding Gideon's pregnancy with me was really good. The midwives didn't do anything that was um invasive or constantly checking my cervix. I literally went to the doctor's office like normal, but my provider would be a midwife. They would check in, see how I'm doing, measure my belly. Every visit there, I would pee in a cup, I guess so they could keep a watch on my urine, samples. And I don't know if they check for blood in the urine, ketones, proteins, whatever they were looking for. With Gideon, I did end up being gestational diabetic, which again, sometimes going through a traditional doctor's office, it can be kind of abrasive sometimes, I will say. My midwives were very nice, but again, with a doctor's office, I had four. I had four. So if one was out or on a birth or not working that day, I would see multiple ones. And sometimes it felt like that they did not communicate with what was going on with my care very well. So when I would see another one, they would say something totally opposite from the prior one. So whenever I found out I was gestational diabetes, I remember we were in Arizona, of course, no family. We were told we couldn't have kids possibly. So that's when we went out west for work and this and that, and found out after a month and a half of being out west, while I was working and my husband, out there with me building our business, that we found out we were pregnant. So, our mission was to get our care started. But saying that, going to somewhere where I didn't know anybody, I got the recommendation from a nurse friend I had made out there that would be good for me to go to that office. And it was in Ahwatukee, Arizona. The midwives there, oh man, I found out via phone about me being gestational diabetic, and it was no like compassion, no empathy, no I actually like kind of went off a little bit because they told me via voicemail, because I was working a 12-hour shift that day, and I called back frantic like, what you hear those words and you're like, that's scary. I've never experienced this in my life before. So that was what was different regarding like during my care. When I went into labor, with Gideon. I called my midwife as I was instructed to do, went to the hospital. Now, my midwife, at that time that we prayed that would be delivering Gideon, actually was the one that was on that night. So I was so grateful because we just didn't click with all of them. It was one or two that we were like, okay, really one. Her name was Misty. That we were like, okay, we were praying for Misty because she to me seemed the most like compassionate and understanding, and just took her time. A very good vibe type person. So she ended up being the one on call that night. We went into the hospital. Now my labor lasted for 10 hours with Gideon, but I remember the nurses immediately when I got there wanted to check my fluids, and I was like, hold on, I have a midwife. Call my midwife before y'all start poking and prodding me, because I don't know, what is needed and what may not be needed that they want to do that I don't need necessarily. So my midwife told them, no, don't check her fluids. You guys don't need to, check her cervix, And the lady that was checking me in, the nurse, she just kind of felt down there and slid it on top of looked like a microscopic, what do you call those, babe? That you put samples on when you're looking under a microscope. No, the slide, I guess the microscopic slide thing, and she put some fluid on that, and she said, we'll check and make sure that this is amniotic fluid, and it was. And so when I got checked into the room, they put the monitor on my belly. Knowing what I know now, I would have had a birth plan written out because I wouldn't have wanted that, Also, they put an IV in me, and I remember it was a nurse training another new nurse, and they missed a couple times. So that was, a little challenging with contractions, and then them wanting to sign all the paperwork while I'm contracting in the room was a lot. So it was just a lot of movement, and ideally when you're birthing, at least me, I like it quiet. I like a vibe set. I like sounds like white noise, waterfalls, ocean sound, something soothing, So I do remember the nurses were kind of like getting impatient with me while I was trying to birth as well, which was kind of unfortunate. And one of them, I literally had just got back in bed from moving around how I wanted to do, because I loved moving around during my pregnancy, but she didn't know I was up already, and she tried to she came in the room and was like, you gotta move, this baby ain't gonna never come out if you don't move. And I was like, I just was up, So again, he came out healthy, safe, but I will say in a hospital setting, it's more stressors and more tension. When I actually called for an epidural because I didn't know at the time what my body was doing, and my midwife, due to all the chaos, she failed to tell me that it was called a transition period. Whenever you get nauseated or when you feel like you just can't anymore, 9 times out of 10 the baby's head is there already. In my case it was, we just didn't know it. I remember being in the tub because I didn't do a water birth with Gideon, but I did birth in the tub, and I told Davon I couldn't do it anymore, I need an epidural, and I had told him don't let me get one, but he was like, babe, as long as you and the baby's safe, that's all that matters. And my midwife was saying the same thing. Is it still recording, babe? I just want to make sure. But they called for the anesthesiologist to do the epidural, and it took forever, but she did not check me, and she did not tell me that that was called a transition period. I think I threw up. He was like probably 10 to 15 minutes from being born at that point. The anesthesiologist came in the room, missed 3 times for the epidural. Yeah, it was really bad. And after the last epidural try, he got it. But at that point, she was like, oh gosh, his head is coming out. You're feeling how you're feeling because you're about to have the baby now. And I was like, oh my gosh, she should have checked me because I wouldn't have called for an epidural. Again, first baby, I didn't know what was going on, so that happened, and then after which I was sleeping, recovering, and woke up and was connected to an empty bag. I don't even know what it was. Nobody got my consent to hang any medicine. Nobody told me anything. I just woke up and the bag was empty. And I remember the nurse that I had telling the newer nurse that, because I was like, what is this? What is this? And they were like, we gave you Pitocin. And I was like, I didn't want that. And I probably would have been fine and nicer about it if I would have known someone was hanging medication in my arm, but I was asleep, So, and I do remember my reaction came on the tail end of finding out that the new nurse from the old nurse, I heard the old nurse tell the newer nurse, oh gosh, you should have been checking her, while she was receiving that Pitocin because she could have bled out. So again, for me being a brown woman, a black woman, if you will, I know that there are definitely like maternal mortality increases amongst my race in the hospital. And so after that, I knew, as long as, you know, everything went well with myself and I stay healthy and it's, okay, I would birth at home and get a midwife for the home area. And so fast forward, I know I'm telling a lot of backstory, but very in-depth things happen. So I definitely want to give a good scenario and not rush through this because it's definitely something so sacred, so important, and your most vulnerable time in your life as a woman. I want to make sure that I treat this topic with as much information and sensitivity as I can. Would I birth in the hospital again? By choice, no. But again, after Gideon was Judah. Judah's home birth went superb. And we were able to have, just a good understanding of what was happening. The phases of labor was very much so explained to me by my midwife. I didn't have but one midwife, one nurse, Bethany and Nurse Catrice, and my midwife's Bethany Arrington with Genesis Birth and Wellness. Shout out you guys because y'all are absolutely amazing. They delivered Judah. He was born at our old house. If you guys see that, I think it was a short that we did for his birth. So it's on our YouTube. 8 pounds, 5 ounces, born in our bathtub. He came before the birthing tub could even be blown up. So he came at 38 weeks. So anyway, but yeah, by choice, no. By necessity, yes. So our third son, Jaira, passed away at 21 weeks. 20th week anatomy scan showed him having no heartbeat. So we do have a video as well on our YouTube channel about our process through that and how to manage if you have experienced loss of a child, and we give some resources and kind of share our story. So if you haven't checked that video out, please do. But I had a birthing plan, right, to birth at home with Bethany and Catrice with Genesis Birth and Wellness again. But however, the anatomy scan, we didn't know anything until that time that something was wrong, and it was just no heartbeat. So we ended up going to my midwife office, and the next day, literally, world turned upside down, having to be admitted to the hospital to have a baby that is not alive, and so I was in labor, and when the contractions got unbearable, I had to get an epidural because they were inserting medication in my cervix to make me have him. So the contractions were not what's the word I'm looking for, normal. They were constant. You did not get a break. And again, hospital setting, the nurses nor the doctors, even though they were so amazing with my situation, specifically, they're those type of professionals that are experiencing this on a constant, often scenario, with mothers. So They were all so accommodating emotionally, but as far as like knowledge, I did not know. No one told me that my contractions would be so intense and so like strong and constant. And so the nurse told me after I mentioned to her, I said, I'm not getting any relief. Like I said, it's the medicine that you're giving me gonna let me have a break. She said, no, once the contractions start, they're constant. And I remember telling her, oh gosh, that would have been nice to know, because knowing that I had to birth pretty much a dead child, I wanted to be comfortable and not have it be stressful. You want to have as much peace as possible. And so the medication I found out was actually 3 times the normal dose to have me have him, so, and he did come out vaginally. We got to love him, baptize him, all the things. Like I said, they were very accommodating. They took pictures of him, all the things, but dressed him even in baby clothes. But again, it was a little bit of a, oh my goodness, there and getting the IVs and all the things. I'm a nurse and I'm, aware of things that happen, but I'm really a patient when I have been a patient. I try not to be a nurse. And so I'm real big on just being informative though. So, being in the hospital setting, I did not get that, and honestly, it wasn't my midwife's job to do that, because after we went to her, before we were admitted into the hospital, after we found out, I'm sorry, there was no heartbeat, we went to her, and she told us that the hospital system would be taking over my care, and she would communicate with the provider, which she knew very well. So I felt safe, but I didn't get as much information from the providers and the nurses as I would have liked regarding how I would feel regarding the contractions and things of that nature. So, but again, it was still way more peaceful than my first son's birth, Gideon. So fast forwarding, here sits our rainbow baby, our rainbow baby, Noah. I have a Judah, I have a Noah, I have Jireh. Jireh's in heaven. Noah's right here. He's our rainbow baby. And so Noah, this postpartum period, to answer your question, Bianca 9779, which is a subscriber on our channel. Thank you again for your just being open about wanting my advice or my insight. This has been the most blissful home birthing experience, postpartum experience I've ever had. I'm so grateful. Again, Bethany Catrice, midwife Bethany, nurse Catrice, were my providers the whole pregnancy with Noah. We didn't have any issues at all, other than the fact I was down with something viral, whenever we a couple weeks prior, and then to me birthing him into like my week, I think 4, I was fighting off something viral. But outside of that, the pregnancy was beautiful. The peace, my husband had the pool blown up. I was able to manage my own contractions on the birth ball. Then when they got here, they checked me one time, not multiple times. They checked me one time. I was 4 centimeters, and they did so many mechanisms with me. I did the peanut ball on my left side, laying on my left side with the ball between my legs. I did the peanut ball laying on the right side for an extended amount of time. I was able to do they call them booty jiggles on the bed, like a downward dog position, and my husband could shake my hips to try to get the baby in position. And I also got to labor on the back of the toilet seat, or on the toilet seat but facing the back of it, like straddling it backwards, and that helped. And so by the time I got into the water, my labor had been, I can't remember, maybe 11 hours, because my water broke. I can't remember. Babe is over there, but he's got his headphones in. But my water broke, I know, about 1:40 a.m. How long did we labor with Noah?
Was it like 10 or 11 hours?
10 or 11 hours, yeah. So but it felt like fast to me because of being over in the morning laboring. My midwife and the nurse didn't get here till like 7 or 9. Between 7 and 9 o'clock, my nurse got here first. And I was the 4 centimeters, and I remember like thinking, oh my gosh, I'm gonna be birthing through the evening. They were like, no, 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 that we can do some positions and things to help you. It was very informative, you know, and they were just so supportive and allowed me to birth my way. And I did the horse lips. Normally, I just moan through my contractions and deep breathe, but I saw something where you can do like the horse lips, like during the length of your contraction, and that helped me so much. By the time labor was over, my mouth was so dry, but it helped me so much. And I remember telling them I'm getting tired of doing that, but they said, well, you can do something different. They never told me to do that, but my body did, and they allowed me to do that. They said whatever you need to do, you can do. Another thing, I was able to eat during labor. I was already weaker from fighting off the viral thing. Now, it's not, it was the most difficult scenario birthing while sick, right? But because I had the right team in place, it made it easier. And it was my first day, I actually felt a smidge better. When I say we were sick, guys. You guys can see it on the channel. We were so sick. But everyone in the house was sick. So it wasn't just me. But oh, but yeah, guys. I could eat. My nurse was feeding me 2 bites of yogurt. She's like, just a little bit, just to coat your stomach, because you can get nauseous during labor, and I'll be. You'll see a postpartum essentials video that'll be posted today, since it's Saturday. This video will probably come out tomorrow, but on Sunday, because we're starting our Sunday Wednesday schedule. But guys, oh my gosh, if I can get it posted today, I will. But I posted a good bit today, so we'll see. But y'all, that even, being able to be fed during labor. My husband, my nurse got my affirmation cards. I had my birthing affirmation cards and had Davon, my husband, read them to me, and I repeated after him. And that helped me so much when I felt like I couldn't do it anymore, And by the time I got in the water, um that gave me so much relief. And they allowed me. My midwife told me at my appointment, she said, I never seen anybody do what you did. I totally surrendered in the water. It was like my body naturally surrendered, like, and I went full out Superman. I was like this, holding on to the handles on the side of the birthing pool, and my butt, my back, everything, my legs just floated up. I was floating on my belly, just holding on to those handles. And immediately I felt like he transitioned into the right position. He was always head first, but it felt like he locked in at that point. And probably I was in the water 15-20 minutes and Noah was born, So I got to experience, again, with all my babies, I did the delayed cord clamping, which they respect that, and they actually encourage that. I've been able to decipher between whether I want to do pediatrician or not and not be judged for it, whether I want to vaccinate or not and not be judged for it or not be pressured to do it. What do I want to give him postpartum? Vitamin K, erythromycin, eye ointment, like, yeah. And my midwife this time around, they didn't do it with Judah, but because of me being so sick, she said, may I give you a liter of dextrose, like some sugar water, some electrolytes to rehydrate you and hopefully help kickstart your healing viral illness. Because y'all, my body took such a hit already with laboring and losing fluid, but I hadn't been able to really keep much down due to mucus. It was not because I was sick to my stomach, but it was mucus. And on top of, before we got sick, I experienced allergies, food poisoning, being nothing to eat or drink for 16 hours, and then the viral whatever came through. So my body was in a compromised, vulnerable state. So she asked me, and I was like, of course you can give me an IV. She waited to have the nurse to give me an IV after labor, and she said I felt like during labor it would have been too much contracting. She said, so I offered that to you after laboring, and I was so thankful, just understanding the right timing. And they're understanding, they're seeing what's going on with, versus in the hospital they don't care, you're in there. Honestly, I can say my experience, they didn't really care. You're in their vicinity. So they're waking you up right there, poking and prodding, not really asking for your permission. They'll just say, okay, let's check you. Let's do this versus may I or can I do this for you, So that candor I love, on top of just the hands-on. She was checking my blood pressure. The nurse was checking my blood pressure after. They asked me, did we want to do vitamin K for Noah? And we were like, yeah, because that helps with the clotting of the blood after birth. And they didn't even do the erythromycin drop. She said, I feel like you don't need that for him. Judah, we did do it, but I asked him at my appointment, did he need it? Because I noticed they didn't do it. And she was like, no, I didn't think he needed it. So I love, with a midwife perspective, that they don't force you if they don't think a baby needs something, and then they don't judge you. Yes, and not only that, at the end of my pregnancy, as you guys know, in a previous vlog, I had a few blood pressure issues to arise. Evidently, blood pressure issues are just as common as gestational diabetes. It just kind of picks whoever it wants to pick. And so I had a few high blood pressure readings, like my postpartum day 8 on my appointment. So they were able to intervene and help me. And my midwife again asked me, could she treat me with a couple medications, although she really felt like, due to me not having any medical history of blood pressure issues, she still wanted to treat me due to it being something common postpartum, just with the hormones needing to balance back out. And so again, she asked, could she treat me? And then she really educated me on just, nothing's wrong with my body. This happens sometimes. It's their job to make sure that we're okay. Don't, think it's just picking on me or anything. It just happens. And that was amazing, because I was already a little anxious as I scored high. I would say mild anxiety, like a 1 or 2 on my anxiety screen. And so my nurse already knew I had high anxiety, because we were all so sick, just trying to jump into like this new postpartum life with 3 kids now and a spouse, and recover. The whole house, was already kind of had us heightened a bit. So she was like, postpartum therapy might not be bad for you. I said, my job offers like 6 free therapy sessions, so I'm gonna take them up on it and see if they offer. Okay guys, I literally just got a whole tutorial from my husband about YouTube, and I told him it's just stressing me out. Just let me record the way I record, because it's really stressing me out about this camera. It cut off like in the middle of my video, and I was literally done. So I don't know how much more, so I had to stop and re-listen to where I left off. So I'm so sorry, y'all don't know it, but that's what's happened. I'm now in selfie mode, where I can see myself and talk how I normally do. And I fed and changed Noah in the meantime. So yeah, let me get back on track now that I know where I'm at. So pretty much, I was just saying how, the delayed cord clamping, all the things are great when you have a provider that aligns with what you believe in, right? And I just want to go like here, because medically, my blood pressure went up after I had Noah, right? And you guys will know that from the previous vlogs we've posted. My midwife, she told me if it was any other provider, they would send you to the emergency room. I think my pressure was like 140 or 150s over 102, 104, right? And I was like, oh my gosh, that's so true, because when I was a triage nurse, um I would get the calls of postpartum moms and their blood pressures would be up, and I would have to tell them per their doctor's notes they have to go to the ER, and it would just be so devastating to them, and I was in that same boat. So I I was like, oh my gosh, what's going on? But she said, it's me. I'm not gonna, she said, I've delivered y'all's babies before. I know the full, Monty on your care and what's been going on with y'all fighting that viral bug or whatever. So she said, I'm gonna chalk it up to that, or you guys losing sleep and just you in general trying to recover from literally being sick almost like a month, from allergies to food poison, then to the viral thing. So it ended up being, thank God, where she even said, may I treat you with some medication. She said, you don't have a high blood pressure history. This is just something that picks and chooses a mom, just like gestational diabetes does. So don't stress yourself out about it. But we're going to intervene so it doesn't go up higher until your hormones balance out, right? So I was okay, with her treating me. I was initially a little anxious going into it because I didn't know what to expect, and I'm like, more medicine, is it gonna make me feel worse than what I've already felt, trying to recover from illness and birth and breastfeed and take care of your other sick babies. Now granted, I was in bed, my hubby was doing the best he could. We were both trying to balance them not feeling well still after we had him, but thankfully they only had cough, so it was just administering cough medicine for the most part. But just all of those things, just with the burden on the house at that time, she said my pressure was probably up from that and lack of sleep, of course, being a brand new mom again to a third child. So thankfully she wrote me for 2 weeks worth of medication, and praise God, I only had to have a total of 3 days worth, and the rest is in that drawer right there. I need to throw it away or put it up in the cabinet in the kitchen, the higher cabinet, but it's a child lock on there, so you guys don't worry. But yeah, I was just thankful to have my midwife, because even when things went south a little medically with my blood pressure, she still saw holistically me as a person. And I would say that's the benefit of having a home birth team versus just a traditional medicine team. They look at the whole individual. They don't do things that's unnecessary. If it's not necessary and they've taken the time to know your care, and you're not just another number to them, you're literally a person. They really care. And I'm not saying traditional medicine, they don't care. I just have seen, like in my job, like my previous remote job, triaging. Okay, if it's this, and this, no matter who the person is, tell them go here. That to me is just kind of not fair to the patient, not fair to the person, not fair to the mom, because she's already did something super dope and honorable with bringing a life into the world. Your body's already went through stress. Why add more? So yeah. Also, I love having a midwifery team because versus traditional and hospitals, because if you are a mama or family who doesn't believe or want to vaccinate, or doesn't want to do certain medications after birth, like the erythromycin eye drops or vitamin K. They're not forceful. They respect your right and to choose to make your choices and whatever you want your child to have. And my midwife made recommendations to us of pediatricians that we could actually take Noah to whenever we felt like he was old enough to go, so his system can have time to get used to the new world he's in, As they know, with our boys, we don't take them anywhere unless they are sick, right? But she did say it might be good to get them established somewhere that way. So if you need a pediatrician, you have one. But she didn't say you need to do this, like I've heard before from other pediatricians that, I've not spoken with, but I've um, heard on different platforms, and even in our life with Gideon, when he had one out west, she was not forceful, but kind of pressuring of what she thought we should do regarding vaccinations and that thing. And I think every parent, mom, dad, family has their right to do it how they want to do it. As long as you're not harming your child, it's okay to go against the grain and do what you feel is best. And so I like and love how my midwifery team has been with me, just completely as a woman, a mom, and with my baby as well. They didn't force anything, at all. Even with the fluids and the Pitocin, putting that in the IV bag at the end, just to help my uterus contract better. She explained it. She asked me, and instead of just telling me it's something that I needed, she asked me, could she do it? And is that something that I would want? So the freedom to be you is what I'm getting at. And so I do hope that this video has helped all the moms watching the channel. Y'all, we are amazing. I salute you all for what you've done, for what the sacrifice your body has made. And we're going to continue loving our bodies, loving on ourselves. And you get that support here through this channel, through me, regarding motherhood. Because I can't speak on fatherhood, but motherhood definitely. And I want you to know you are loved, you're amazing, you're valuable. And even on hard days, you're going to get through this. You are enough. And it's going to be fine. You're going to make it through the hard newborn trenches, or postpartum, toddler, whatever, school age, whatever trench you're in. Hopefully you are not going to be there long, So with each new milestone, we went through the trenches, but now we're kind of leveling out. And with each new milestone and each child, they're all different, but being grateful during the process and just not letting it stress you is the main thing. So I hope someone has found value from this video. Comment, like, share even, and let us know. If you haven't subscribed, please be sure to subscribe to Davon and Janisha and continue doing life with us. Again, we'll be posting, our new schedule will start not this Sunday coming because it's Saturday. It'll be next Sunday coming. We'll start posting. You guys can count on us to post Sundays and Wednesdays, and maybe some in-betweens, but definitely videos will be going up on Sundays and Wednesdays, and the in-betweens will be like shorts, things of that nature, and maybe even a live here and there. So yeah, guys, I hope you all are doing great. Continue to enjoy your Memorial Day weekend, and you guys take care. Until the next one.